Welcome to Weekly Neurology Deep Dive. This deep dive is only for educational purposes, and it doesn't have any commercial intent. We're going to give you a helpful overview of a recent research paper, but remember, it's always best to read the full paper yourself for a complete understanding. Today, we're going to be exploring a study about using blood biomarkers to help diagnose multiple sclerosis. Diagnosing MS, as you know, can be a very complex journey, often taking a lot of time and tests. This study looked at whether we could use blood tests to predict which patients with clinically isolated syndrome, or CIS, will go on to develop MS.
That is an important question for neurologists. CIS is essentially a first episode of neurological symptoms, and they could indicate MS, but not everyone with CIS will actually develop the disease. So being able to predict who is most at risk would be invaluable for guiding treatment decisions.
Absolutely. So tell me about this study. Which biomarkers did they look at, and what did they find?
This particular study focused on 4 specific biomarkers: serum neurofilament light chain, or SNFL, serum glial fibrillary acidic protein, SGFAP, serum titinase 3-like-1, SCHI3L1, and the immune response to the Epstein-Barr virus-encoded nuclear antigen 1, EBNA1. Each of these biomarkers is associated with different aspects of MS pathology.
Interesting. I know SNFL is a marker of nerve damage, which makes sense in the context of MS.
Yeah.
What about the others?
Right. SNFL is particularly relevant because axonal damage is a key feature of MS propagation. SGFAP reflects damage to glial cells, which are the support cells in the brain. SCHI3L1 is linked to inflammation, another important process in MS. And lastly, we have the immune response to the Epstein-Barr virus, which has been implicated as a potential trigger for MS in some individuals.
So they're really looking at the disease from multiple angles. Did any of these biomarkers stand out in terms of their ability to predict MS development?
Yes, SNFL was the real star of the show. The researchers found that a high SNFL level at the time of the CIS was a very strong predictor of developing MS later on. This was especially true for those patients who presented with optic neuritis. That's inflammation of the optic nerve, and it is a common CIS symptom.
So if a neurologist is seeing a patient with CIS and optic neuritis, and that patient has a high SNFL level, that's a pretty strong indicator that that patient will likely develop MS.
Exactly. The study found that in patients who didn't yet meet the criteria for an MS diagnosis, those with no dissemination in space or time, meaning there wasn't clear evidence of MS on MRI or in their disease course, a high SNFL level had a specificity of 93.3% and a positive predictive value of 87.5%.
That's pretty remarkable. It sounds like this could be a valuable tool for neurologists in their daily practice. What about the other biomarkers? Did they provide any useful information?
While SNFL was the strongest individual predictor, the researchers also found that combining SGFAP with SNFL provided even more predictive power. In patients who had signs of MS on their brain MRI, but not yet in their disease course, having high levels of both SNFL and SGFAP was a strong indicator that they would eventually be diagnosed with MS.
So in those cases where the MRI is suggestive of MS, but we haven't seen the disease progress over time yet, adding SGFAP to the picture can help solidify the diagnosis.
Precisely. This could be particularly relevant in situations where a lumbar puncture, which is the traditional method for checking for oligoclonal bands in the cerebrospinal fluid, is not feasible or desirable for the patient.
That makes sense. A blood test is certainly less invasive than a lumbar puncture. So are we saying that SNFL and SGFAP could potentially replace the need for lumbar punctures in some cases?
It's too early to say for sure, but this study certainly suggests that these blood biomarkers have the potential to significantly change the way we approach MS diagnosis. Imagine being able to give your patients a more definitive prognosis much earlier in the disease process, using a simple blood test. This could lead to earlier intervention and potentially better outcomes.
It's an exciting prospect, but I imagine there's still some questions to be answered before these blood tests become standard practice. What about the other two biomarkers they looked at, SCHI3L1 and the EBNA1 response? Did those offer any insights?
They did provide some interesting data, but their predictive value wasn't as strong as SNFL or the SNFL-SGFAP combination. For instance, the study found that high levels of EBNA1 antibodies were more common in patients who were eventually diagnosed with MS. This supports the link between EBV and MS, but it wasn't a strong independent predictor.
I see. So the focus really seems to be on SNFL and SGFAP. What are the implications of this research for neurologists in their daily practice? If a neurologist sees a patient with a suspected CIS, would these blood tests be ordered immediately?
It's certainly a possibility. Right now, the standard of care often involves an MRI, a neurological exam, and sometimes a lumbar puncture. But if a blood test could give us early insights into the likelihood of developing MS, It could potentially streamline the diagnostic process.
So even before a patient meets the full criteria for an MS diagnosis based on the traditional measures, these blood tests could provide valuable information that helps guide treatment decisions.
Potentially. Take the example of a patient presenting with optic neuritis. If their SNFL levels are very high, even in the absence of other definitive MS markers, it could push the neurologist towards a more proactive approach.
And that could mean starting treatment earlier, which could have a significant impact on the long-term course of the disease.
Exactly. We know that early intervention with disease-modifying therapies can make a big difference in slowing progression and preventing disability. These blood tests could be a key tool in allowing us to initiate treatment sooner.
This study focused on CIS patients, but could these biomarkers also have a role in managing patients who already have an MS diagnosis?
There's growing evidence that SNFL in particular can be a useful marker of disease activity and treatment response in MS. Some studies suggest that monitoring SNFL levels could help predict future relapses or the progression of disability.
So in addition to diagnosis, SNFL could help neurologists monitor how patients are responding to treatment and potentially adjust therapies accordingly.
Precisely. Imagine a scenario where a neurologist is considering switching a patient to a different disease-modifying therapy. Monitoring SNFL levels could provide valuable data on how the patient is responding to the current treatment, helping to inform that decision.
It sounds like these blood tests could provide a much more nuanced understanding of how MS is affecting each individual patient.
That's the hope. And it's not just about SNFL. Further research may reveal even more ways these biomarkers can help us personalize MS care.
We've discussed how these blood tests could help avoid unnecessary procedures like lumbar punctures. Could these tests eventually replace lumbar punctures altogether in the diagnostic process?
It's important to remember that lumbar punctures provide valuable information that we can't yet get from a blood test. Analyzing cerebrospinal fluid allows us to detect specific antibodies and other markers directly related to MSS. So for now, lumbar punctures will likely remain an important part of the diagnostic process, especially when the diagnosis is unclear.
But it is possible that as our understanding of these blood biomarkers grows and the technology continues to improve, we may see a shift towards using blood tests as a first-line diagnostic tool. Lumbar punctures might be reserved for more specific cases where additional information is needed.
That's a reasonable assumption.
Of course, no medical test is perfect. What are some potential downsides or limitations of these blood biomarkers that neurologists should be aware of?
One key limitation is that these biomarkers are still relatively new. We need more long-term data to fully understand their accuracy and reliability. While this study's results are encouraging, we need larger, longer-term studies to confirm these findings.
So a healthy dose of caution is warranted until we see more data.
Absolutely. And even with more data, it's unlikely that these blood tests will ever be 100% accurate. There will always be a degree of uncertainty and cases where the results could be misleading. These tests should always be interpreted within the context of the patient's individual medical history, symptoms, and other test results.
Another potential concern is the cost of these tests. New technologies are often expensive, and that could limit access for some patients.
That's a valid concern. Hopefully, as the technology becomes more widely adopted, the costs will come down, but it's something we need to be mindful of.
And it's important to remember the potential psychological impact of these tests. It could be emotionally challenging for a patient to receive a positive result on a blood test, suggesting they're likely to develop a chronic disease like MS.
Absolutely. Neurologists need to be prepared to provide clear and compassionate counseling to patients, explaining the results, addressing their concerns, and discussing the potential treatment options.
It's all about using these tests responsibly and ethically to empower patients and improve their care.
I couldn't agree more.
What are some key unanswered questions about these blood biomarkers that you think future research should focus on?
One important question is how to best integrate these biomarkers into existing diagnostic algorithms. Should they be used as a first-line screening tool for everyone with neurological symptoms? Or should they be reserved for certain patient subgroups? Clinical trials and further research are needed to define their place in clinical practice.
We also need more data on the long-term accuracy and reliability of these biomarkers.
Absolutely. And exploring the potential of combining different biomarkers or even integrating blood biomarker data with data from imaging or genetic testing could provide even greater insights into the disease.
This research really opens up a lot of possibilities.
It does. We are just scratching the surface of what we can learn from these biomarkers. I'm particularly excited about their potential to help us personalize treatment plans and predict long-term outcomes for our patients.
The study authors raised an interesting point. They suggest that the traditional concept of dissemination in time as a diagnostic criterion might need to be revisited in light of these findings.
That's a thought-provoking point. The classic model of MS diagnosis has always relied on demonstrating both dissemination in space, meaning lesions in different areas of the central nervous system, and dissemination in time, meaning evidence of disease activity at different points in time.
But these blood biomarkers, particularly SNFL, can potentially indicate disease progression even before we see that classic dissemination in time on MRI or through clinical relapses.
Which raises the question, if we're confident that a patient is on a path towards MS based on their blood biomarkers and other clinical findings, do we still need to wait for confirmation of dissemination in time before making a diagnosis and starting treatment?
It's a difficult question with no easy answers. We want to be certain of the diagnosis before starting a patient on potentially lifelong treatment with disease-modifying therapies, which can have side effects and be costly.
But delaying treatment could mean missing a crucial window of opportunity to slow disease progression. It's a delicate balance.
This is where open communication between neurologists and their patients is crucial. Discussing the risks and benefits, considering the patient's individual circumstances and preferences, and making a shared decision about how to proceed is essential.
I agree. These discussions are never easy, but they are incredibly important.
It seems we're moving towards a more personalized and patient-centered approach to MS diagnosis and treatment.
I think so. And I believe these blood biomarkers will play a key role in that shift.
What does the future of MS diagnosis and care look like through the lens of these new biomarkers?
It's certainly a fascinating area of research.
So as we wrap up our deep dive into the study, what does the future hold for MS diagnosis and care? What does this future look like through the lens of these new blood biomarkers?
I envision a future where diagnosing MS is much quicker, less invasive, and more precise, instead of the often lengthy and uncertain process we have now. Just picture this. A patient experiencing neurological symptoms gets a blood test right away.
Okay.
And this test could give a clear indication of the likelihood of developing MS, potentially avoiding more invasive procedures like lumbar punctures, at least in some cases.
That would be a significant change. And with earlier and more accurate diagnosis, treatment with disease-modifying therapies could begin sooner.
Precisely. Earlier intervention is key to slowing the progression of MS and preserving brain health. These blood biomarkers have the potential to make that a reality, but I see them playing an even larger role, going beyond just diagnosis. I believe they'll be critical in personalizing treatment plans and predicting long-term outcomes for individual patients.
So moving towards a more individualized approach to MS care, tailored to each patient's specific needs and disease course.
Yes, exactly. Imagine using blood biomarkers to predict how a patient will respond to a particular disease-modifying therapy. This could help us choose the most effective treatment from the start, minimizing trial and error and maximizing the chances of a positive outcome.
It's remarkable to think how this research could change the landscape of MS care. You mentioned earlier that more research is needed, particularly larger-scale long-term studies. What key questions do you hope future research will address?
Well, one of the most important questions is how to best integrate these biomarkers into our current diagnostic algorithms. Should they be used as a first-line screening tool for everyone with neurological symptoms or reserved for specific cases? And how should we use them in conjunction with existing tools like MRI and lumbar puncture? These are questions that future research and clinical trials will need to answer.
More data on the long-term accuracy and reliability of these biomarkers is also needed.
Absolutely. We need to understand how well they predict disease progression over 5, 10, or even 20 years, and exploring the potential of combining different biomarkers or integrating blood biomarker data with imaging or genetic testing could provide even greater insight into the disease.
There's certainly a lot of potential here. But translating promising research into real-world clinical practice often comes with challenges. What are some of the hurdles you foresee?
Well, as we've discussed, large-scale, long-term studies are essential to validate these findings and to answer those key questions about how best to use these biomarkers in practice. These studies are complex, time-consuming, and expensive to conduct.
But ultimately, they are an investment in the future of MS care.
Indeed. Collaboration is another critical factor. We need researchers, clinicians, patients, and advocacy groups to work together to ensure this research translates into tangible benefits for those living with MS.
Breaking down silos and fostering partnerships is crucial.
Precisely. And as with any new technology, we must consider the ethical implications. These biomarkers can provide valuable information about a person's future health. We need to use this information responsibly, ensuring that it empowers patients without causing undue anxiety or fear.
Open and honest conversations with patients about the meaning of test results, the uncertainties involved, and the potential implications are paramount.
I couldn't agree more. It's all about empowering patients and improving their care.
This has been a fascinating discussion about the potential of these blood biomarkers to change the landscape of MS diagnosis and care. We encourage our listeners to delve into the full research paper themselves for a deeper understanding. Until next time, stay curious.